Good evening. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. 2 weeks ago, we announced changes to the public health orders to help slow the spread of the third wave that we were in at the time. Last week, we announced further restrictions to try to avoid a full lockdown of services. Tonight, we're issuing even more stringent public health orders to stem the rising number of cases. Effective 12:01 on Sunday, May 9th, the following restrictions will take place. Outdoor gathering sizes will reduce to 5 people, and this includes household members. Following businesses and activities will be required to close. Gyms and fitness centers, casinos and VLTs, museums, galleries, and libraries, indoor community, cultural, and religious gatherings, personal services, indoor sports and recreation, dance theaters, music schools, and day camps. Restaurant, bars, and patios will close to in-person dining, but will be able to provide takeout and delivery services. Outdoor sports and recreation will have a maximum of 5 participants, and organized team sports will not be permitted. Retail stores, garden centers will be open at 10% capacity to a maximum of 100 people, whichever is lower. Malls are open at 10% of that facility's capacity. Self-help gatherings will be allowed a 10-person maximum. These orders will be in effect for 3 weeks until May 30. We've discussed in the past with our public health orders the need to implement these in these times of rising case counts and strain on our healthcare system, but these public health orders can't be written to guide every aspect of our lives. We know that we all need to make personal choices to reduce the amount of contacts that are outside our households, and we need to act now. I know that Manitobans have done this before. I know we've been doing it now for 14 months. But we need to continue our efforts to keep these numbers down. We all need to take steps, certainly to follow these new public health orders, but we all need to take those own steps that we can put in place to reduce the amount of contacts we have outside of our household. Today's case numbers are certainly going in that wrong direction. The latter part of this week, we've seen a dramatic rise in cases, and that's translating into a dramatic rise in ICU numbers. So these are some of the highest daily numbers we've seen in our 15 months. We have to take these strong actions now to protect our healthcare system, to protect Manitobans. And so everyone has that role to play right now. Everyone can today reduce the amount of contacts they have outside their household. We know the fundamentals that we discussed, and certainly staying home when ill is one of them, and that's one of the most important. We know washing our hands and wearing masks certainly in indoor public places, but in outdoor settings, when you can't distance, consider wearing a mask as well. That's our recommendation. One is limit your contact outside your household. Even your contacts in outdoor places right now should essentially be their household contacts. The orders require up to 5. If you can't distance, you should wear a mask. We want businesses and organizations to do whatever they can to make it easier for their staff and patrons to practice these fundamentals, to stay home when they're ill, for staff members to ensure that there's an ability to distance within the facilities. We still have hope on the horizon. We're still vaccinating Manitobans at an increasing pace. By the end of May, we're going to have more than 300,000 additional doses of the vaccine in Manitobans' arms. So we know that this is, again, a short-term solution that's already on top of, we know, a long 15 months. But we've done this before, and I know that Manitobans can do it again. This time we do see that hope. We do see a summer where we have high vaccine uptake and low COVID numbers. So we need to continue to practice the fundamentals, follow and adhere to these public health orders, and do additional. Do whatever you can to limit your contacts outside your household. So thank you again, Manitobans, and happy to take some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this evening from CBC Radio Canada, Mohammed.
Hello, Dr. Roussin, Mohammed from CBC Radio Canada. We aren't seeing anything about schools today. Why public health isn't considering shutting schools in the future?
Mohammed, so this is something we're actively looking at right now, and so we're going to have something in this regard in the near future.
Thank you very much. I have a question. It seems that with the new variant, herd immunity is reached at a level of 90% rather than 70%. Can you confirm that, and how is it affecting public health strategies?
Yeah, and so, I mean, no one knows, precisely what that number is, but we calculate that number by 1 minus R naught, that basic reproductive number, and so the more transmissible a virus, the higher that R naught, then the more coverage you require. So the wild type COVID, SARS-CoV-2, we consider an R naught of 2.5. We feel that the UK variant is much more transmissible, 50 to 70% more transmissible. So then that coverage then subsequently increases. So it's hard to know precisely, but certainly it's higher than what we would have needed for the wild type.
From CBC Manitoba, Aaron.
Hi, Dr. Roussin. This is Erin. Epidemiologists and doctors, when case counts were rising a month ago, were calling for harsher restrictions, faster restrictions, and we're seeing now the numbers building to exponentially in the ICUs. Why are we acting now? Why did this not happen earlier?
Well, one, it did happen, right? We've always had very strict orders. At the end of January, we were in a position to start very gradually loosening things, but we did put in more stringent orders and two iterations with it, and again we followed those case numbers. They continue to climb, so now we didn't have much choice but to again escalate the restrictions.
Thank you. We're hearing from doctors and we're hearing from healthcare staff that they just don't have the staff to manage the numbers that are coming in right now. This is overwhelming already, and the case counts are high. In 10 to 14 days, there's going to be more people in hospitals, and they're already overwhelmed. So that is why I'm asking that question, is why implementing this now and why not more now?
Well, we've seen, we like I said, we've implemented restrictions. We've continued to have restrictions, and we've implemented more stringent restrictions, twice in the last couple of weeks. So we did see the numbers rising. We did respond, and we've needed to even escalate that now.
From the Canadian Press, Steve.
Hi, Dr. Roussin. I'm wondering if you can tell me how these restrictions reflect what you've seen in terms of where the cases are coming from. Are people going to obey the rules because they've gone up and down and they've changed fairly often during the pandemic?
Yeah, so a couple of things there. So certainly we tailor our public health restrictions to transmission, and when we get these higher numbers and we start really seeing just widespread community transmission, so we see widespread transmission, so that's why we have to have these very broad orders with this. But we certainly see a large proportion of cases in that under 40 group. We see it in a younger age groups, the 10 to 19s, the 20 to 29s. A lot lot of this is occurring in those gatherings, those type of gatherings that are occurring outside of households, recreational events, all these activities. And so this is certainly tailored to that. But again, it's widespread community transmission, so that virus is circulating through the community. So we just have to be able to limit where people can gather right now.
And you mentioned earlier that you are actively looking at the school situation and whether to close schools, move to remote learning. That's going to leave a lot of people on edge. Are you on the cusp of making a decision as to whether to go to full remote learning in the coming days?
So we haven't made a decision on that, but we are going to be able to provide more information on that in the very near future.
From CTV Winnipeg, Jeff.
Hi, Dr. Roussin, Jeff from CTV Winnipeg. I'm just wondering if you could explain the outdoor sports and recreation line here in the news release. Maximum of 5 participants. So if somebody plays, say, soccer or baseball or something else outdoors, and they practice with their coach as long as the group is 5, or is this just meant for people going out and doing, this on their own for recreation?
Right, so we're not having organized team sports, so certainly no games, but whatever does occur has to have that maximum group size of 5. And so again, we know transmission is less risky outside, but we're seeing a lot of gathering amongst people outside of households outside, so that's why we limited this further. And then there's a lot of things that are connected with it when holding, especially organized things. So we see, you mentioned soccer practice, so we'll see soccer practice and coaches doing their best to maintain distancing and all the fundamentals there, and then children from 4 different households get in the same car and drive home. And so there's a lot of things that are connected to these type of places where people gather. And so right now we're at such a critical point. We have to right now stop these transmission chains. So we need people to really limit the gathering they have outside of their household.
Thank you for that. Why the need to go to 10% for retail?
Well, it's that same thing that we have this widespread transmission, so we want to decrease the ability of gathering. We know that in the retail settings, it's lower risk than that prolonged indoor contact that you see in other settings. But again, we want to limit crowding as much as possible, and we really want to, limit really non-essential things. Right now where our hospitals are filling, so we need people to really limit their contacts, do the essentials, but really limit their contacts outside their household. And so we're just limiting that capacity across the board.
From CHVN, Taylor.
Hi, good evening. We've typically seen older people get COVID, but why is there such a spike in younger adults? Does it have anything to do with work or other usual activities?
Well, I think the biggest change right now in this wave compared to last wave is the variant of concern. So we're dealing with this B117 variant, which we've seen in other jurisdictions, makes younger people sicker than what we dealt with the wild type strain. So certainly there's the impact of vaccinations. We have a lot of our older population already vaccinated, so we see that benefit, and that's part of that hope that we can see looking forward. But we know this variant of concern has and is affecting younger cohorts here.
You said earlier you just made changes to these health orders. Why are we seeing stricter restrictions just 2 weeks later? What has changed in our cases in that one incubation period?
Yeah, and so, I mean, again, we'd prefer to be able to give a little bit more time to assess the impact of those restrictions, but you could see our case numbers, dramatically increase at the latter part of this week, and then connected with that are the reports we're hearing from the acute care facilities of more and more people and younger people getting admitted to ICU. So we didn't really have much of a choice. We had to act very quickly here because we need to ensure our healthcare system's there for everyone.
From the Winnipeg Free Press, Kevin.
Hi, Dr. Roussin. I guess probably people say once again, people 2 weeks ago saw this was coming, that unless the numbers change dramatically just in the next few days, that we may see numbers that are higher than they were back in the second wave. Wondering in terms of things like thinking 2 weeks ahead, why wouldn't we just shut down, like instead of leaving stores open at 10%, why wouldn't we go back to just a curbside or pickup for every non-essential service or retail for now and try knocking things down further faster in terms of the numbers?
Yeah, and so, I mean, I think this is always that, that balance between things. So we think at 10% capacity, we've just dramatically reduced the risk. We've made it less likely that people are going to be going out. It's less convenient to be able to go out with significant capacity limits like this. And then, of course, we need Manitobans, and they have in the past stepped up to make those decisions that, right now is a time to be staying home mostly. If you're going out, make sure you're, gathering pretty much with your household only, but certainly limit those gatherings. But for right now, we're encouraging that curbside pickup and delivery. All those options are available. Meeting people remotely. So we really need Manitobans to see how concerning this is right now, and how important it is to adhere to these orders and to go, to make those decisions to limit our contacts.
And there are thousands of people that are vaccinated. There's thousands of people that are fully vaccinated. With all these restrictions coming in, nothing changes for them. They also have to follow all of the restrictions.
Yeah, right at this point, yes. I mean, this is something that we're looking at. I mentioned that hope that more and more Manitobans every single day are becoming protected, against this virus. And so I think that we can be optimistic looking forward. But right now, the levels of transmission, we can't be dealing with treating some Manitobans differently than others. We just need all Manitobans to chip in yet again to bring down these numbers.
From Global News, Merrick.
Hey, Dr. Roussin, are you confident the in-person dining rule will be, rules in restaurants when they're open in general will be strictly enforced enough? Was that a problem when making these new restrictions? We've heard from some establishments that, as long as people sign a consent form, they'll let them sit inside or they'll let them sit with other people. Was that at all an issue when closing restaurants this time around?
I think the bigger issue is that, we're at a critical stage, and so we just aren't going to take any chances. We know that, typically through multiple waves and other jurisdictions, that prolonged indoor contact is a risk factor for transmission. We tried to reduce that by having that household gathering rule, but there's challenges with enforcement and things. So we are just at a stage right now where, these settings that have this prolonged indoor contact, they are going to be closed for the short term.
And also, you mentioned previously in a couple different occasions tonight, the hospitals are filling up, ICUs are filling up. Just quickly explain that to people that maybe won't be fans of these orders, the severity of our ICU and healthcare situation compared to how it was in the previous lockdown before Christmas.
Yeah, I mean, we're seeing numbers. We're seeing on, an earlier in the week, 10 people admitted to ICU in a single day, 6-7 people admitted in a single day. So this is a huge, amount of numbers, amount of individuals being admitted to ICU. So certainly that puts that strain on the healthcare system. And, and like we saw back in the second wave is that, of course, the healthcare system is prepared, and we have such fantastic people responding to this and dealing with it, but it comes at the cost. So we can't provide all the non-COVID care. So this starts affecting people not only who have COVID, but everyone who's going to need the healthcare system. So we need to bring down these numbers. We need to make sure that healthcare system there is for everyone. And the surest way to do that is for us all to dramatically decrease the amount of contacts we have outside of our household.
From CJOB, Skylar.
Dr. Roussin, you had to do this news conference at 6 p.m. today because you were in court fighting or testifying against people who are fighting these restrictions. And of course, tonight you announced more. How exhausting is that personally for you? And moving forward, if we see more anti-mask protests or anti-lockdown protests, will there be a message sent to those individuals who participate?
I think this pandemic has been a long 15 months on Manitobans. And so I think it's taken its toll on all of us. And so, again, we can reiterate that optimism. We have a significant proportion of Manitobans receiving that vaccine, and more every day. So I think we there's that optimism there. But I think Manitobans are exhausted. But we have it in us to do this one last time. To get through this third wave. And then as far as enforcement goes, I think that every, it has to be a component of our public health response. Again, I'm not directly involved with that, but, there are things in place to ensure that enforcement is adequate.
Thank you for that. And just on the I guess the tone of optimism that you are trying to turn this into. With vaccines rolling out, does your team see a roadmap to recovery that's a lot quicker than the last two shutdowns? The second shutdown ended up lasting longer than the first one, at a time where, you think we would know a little more about the virus and be more prepared. So now we're going into this for the third time. We've seen other jurisdictions, like in Toronto, they're going on 6 weeks. Are you confident we can see a change in the end of these orders in 3 weeks' time?
Well, I think that's certainly a possibility. We've delayed our third wave here, so we have much more Manitobans vaccinated at the start of our third wave, and we're continuing to roll it out at an advanced pace. So, of course, it's going to depend on the numbers we see and the capacity of our healthcare system. But we know. Whether it's in 3 weeks or whether it's going to take longer, the quickest way out of this is for as many Manitobans to get vaccinated as quick as they can.
From the Winnipeg Sun, Scott.
Hi, good evening, I suppose. It appears for Manitobans that we've kind of beat about around the bush here when it comes to these restrictions for the last 3 weeks, and they weren't enough the first time, nor were they the second time. What assurances can you give Manitobans tonight that they won't have to go through another night like tonight?
Well, I mean, I think if you look at these orders, I think they've gone fairly far. I think that they are clearly indicating that we need a change. And that we need to decrease the contacts that we have. So, I think these are very stringent public health orders. Not that the other ones weren't restrictive as well, but I think we've escalated these orders to the point where we're going to see Manitobans start changing the way they're interacting.
Thanks for that. that, we haven't seen modeling. We haven't seen any of that stuff. There was a story yesterday from the CBC showing that we knew that we would be in this spot. It still begs the question. I don't think there's an answer for it. Why are we here at the moment?
Well, I mean, I think that this is a third wave that we've seen in other places, and we have public health orders in place, and we really do need to use that least restrictive means. And so we have Manitobans that are exhausted from adhering to these public health orders. We had a period in our response where numbers were going down, hospital capacity was starting to catch up, and so we were, in a position there where we were required to loosen our restrictions. We need to have these restrictions be the least restrictive that we need for that time. As we saw numbers come up, we've clearly articulated to Manitobans that we're concerned. We clearly articulated that we're in a third wave and dealing with a new variant. And then we escalated the orders. We escalated them twice. And so now we've, again, in a position where we really have to escalate them even more, and that's what we've done here announcing tonight.
Our final reporter this evening from CBC National News, Cameron.
Hi, Dr. Roussin. Just looking ahead here, the next 3 weeks that it's being prescribed here in terms of social events, you've got Mother's Day coming on Sunday, and then you've got the May long weekend. How concerned are you over the temptation for people to, go see grandma or, to get together, whether it's a park or a campground or whatever on the long weekend?
Yeah, and so, I mean, these social gatherings are what's driving our numbers. And so we're concerned about these, but at the same time we acknowledge, obviously, Mother's Day, how important a day that is for so many Manitobans, and yet another important day we need to do differently, and people are getting tired of that. And then May long weekend, another special weekend for Manitobans. They bringing in summer for most of us, and so yes, so these type of gatherings do concern us. This is where we see transmission occur, but we're cognizant now that these orders are really going to force us to celebrate these days much differently once again.
And on other events today, after appearing in court today, how confident are you in Manitoba's position and in the legality under the charter of these restrictions?
Well, yeah, I'm not going to speak to an issue that's before the courts right now.
Thank you, Doctor. This concludes our media briefing.
Thanks.